Hi guys, my name is Brittany Hampton and I'm here today to talk to you about my behavioral change program. So for my project, I'm implementing the PEC system with an 8-year-old child with autism in order to decrease his verbal outbursts for unpreferred activities, and we're implementing that at his home with his parents. The purpose of this article review was to determine if the implementation of his PEC system can be generalized across different settings into his school system, because we would like to move it over there. So for my article review, I reviewed the article titled "A Further Evaluation for Behavioral Skills Training for Implementation of the Picture Exchange Communication System." And that's by Krista Homolitas, Rosio Rosales, and Lindsay Campbell. The independent variable for this study are the instructions that the teachers were given, and the dependent variable is the number of responses that were correct on the checklist that the teachers were given when implementing the PEC system. So the teachers were trained to implement phases 1, 2, and 3A of the PEC system, and they were teachers who worked at a therapeutic center for children with autism. All of the children were between the ages of 2 and 7, and all of the teachers had a bachelor's degree and had worked at the center for at least 6 to 18 months. At the beginning of the training, teachers were shown how to implement the PEC system. The behavioral therapist would implement it with a child, and then the behavioral therapist would model what the teacher had just done. They weren't allowed to ask any questions or comment throughout that process, but afterwards they were allowed to ask questions and then were given corrective feedback. During the second phase, the teachers were then shown how to model the appropriate responses with each other, and then were able to practice that with each other. So they had checklists in which they would ask the child a question, and if they got it correct, they would mark it down. And then the IOA for the study was between 89 and 90% for each participant. The results showed that once the teachers had mastered the PEC system and they were put back into their natural environment with their teacher's aid, that they were able to implement it correctly. Some limitations to this would be the fact that the behavioral therapist had to be there to be a consultant. So just making sure that there are structures in place to help those teachers maintain the PEC system without having a behavioral therapist there to consult with. But it does show that the PEC system in all different phases can be taught across various situations and settings. So that's really great for my project, because we want to generalize that the PEC system is valuable for this child and move it across to his school district. So that's my project.